Hi everyone, welcome to another NLP Insider live show and thank you so much for joining us. We will be here live every other week for 15 minutes to talk about everything NLP with industry insiders. I'm David Talby, the CTO of Jon Snow Labs, and today I'm very excited to welcome Yanshan Wang, Vice Chair of Research and Assistant Professor at the University of Pittsburgh. Yanshan has dedicated many years to the research of AI and NLP applications in the biomedical and clinical domains. He will tell us more about NLP for translational medicine and how it can facilitate clinical trial recruitment. I'm so glad to have you here with us today. Yanshan, welcome.
Thank you, David, for having me.
It's a pleasure. So can you please introduce your background briefly?
Sure. So I'm now assistant professor and a vice chair of research, as you said, in the Department of Health Information Management at the University of Pittsburgh. And I also share some secondary appointments in the Department of Biomedical Informatics and in the Intelligent Systems Program, School of Computing and Information at the university. So my research focused on artificial intelligence, NLP, and machine learning methodologies and applications in healthcare. And my research goal is to leverage different dimensions of data and the data-driven approaches to meet our clinicians' need, researchers' needs, and patient needs. I joined Pitt in June 2021 from the Mayo Clinic, where I'm an adjunct assistant professor at Mayo. Thank you for inviting me to this Insider. I'm very excited.
Same here. Thank you for coming. So you have done research in ML and NLP in healthcare for over 10 years. What has changed when you compare now and our same field 10 years ago?
Well, I think a lot of things has changed, particularly in the NLP area. And I think first of all, the workforce or the people changed in the NLP. So, and maybe we want to distinguish general NLP and healthcare NLP, right? In the healthcare NLP, 10 years ago, maybe there are only a few number of people working in the NLP area. But now there are so many people starting to work on NLP in the healthcare domain. And there are a lot of startup companies and also a lot of healthcare institutions. They are interested in building NLP systems in the healthcare system. So that's mainly due to the advance in those programming tools and packages available to people, right? That's the major change I can see. And the second change is the data change. Like 10 years ago, there are not much data for clinical NLP or developing NLP in the healthcare domain. But nowadays we have so much data available. So if you think about the biomedical NLP, we have millions of biomedical articles from PubMed. So you can just download those paper and do some analysis. And for the clinical NLP, we have many public, of course, not many, but still we have public data that is available for us. We can develop NLP system like the Mimic3 data, like the clinical STS data set we released a few years ago. Some data set we can work with. So that's why a lot of people started to working in this area. And also the methodology we use also changed a lot. Like 10 years ago, people are still working using like CNN, RNN. Nowadays, those model, people still using that, but they are a much larger model, like a transformer-based model, like BERT, BioBERT, clinical BERT. Those models become available, and much larger model is coming. It's on the way, right? And those models give people more capability to do the NLP in the healthcare domain. And also, there's some other model built for clinical or medical NLP specifically. For example, the model built by the NVIDIA and the University of Florida is specifically for NLP in healthcare. So those models change also. Those models change a lot. And also, because people started to have more models and more data to work with, people start to think about other things about applying those models in healthcare domain. For example, the regulation around those models, the data bias issues when you build the models, the ethical issues when you apply those models in healthcare, because healthcare is very different from other areas because it really related to patient safety, patient treatment, and those are related to people's life, right? So that's why a lot of more conversations um, come in to discuss the bias of those models, ethical issues of models, and also regulation of those models. And those are all things that didn't exist like 10 years ago.
Yeah, definitely. So it's a fun time to to be in this area.
Yes.
Yep.
Yep.
So you're working on NLP for translational medicine. Can you please explain what this means and describe what is being achieved today?
Sure. Yeah, translational medicine is a growing area in biomedical research. Translational medicine aims to expedite the discovery of new diagnosis tools and treatment using a variety of approaches. For example, usually use a multidisciplinary approach or collaborative or bench to bedside approach. So randomized clinical trials are considered as the gold standard approach because they can deliver the highest level of evidence. So if you want to push drugs or push new treatment or new diagnosis to the market, you have to went through those clinical trials before putting those tools in the market. And translational algorithm informatics or NLP or ML can facilitate those translational medicine because the patient recruitment remains the biggest area for randomized clinical trials. So there is a study found that 20% of cancer patients are eligible for clinical trials, but only 3 to 5% of those patients are identified to participate in those clinical trials. So a lot of those patients, they came to the hospital and they have those, their data. We collected those data in the healthcare record, right? And the promise of informatics, NLP, or machine learning is that we can use their patients' data and identify those eligible patients for the clinical trial, so that we can identify them and send them, some letters or send them, contact them, so that the clinical trials recruitment can be expedited. And also we can reach out to much accurate cohort of patients that could be eligible for the clinical trials. And as you know, the electronic health record contain both structured data and unstructured data. So a lot of clinical trials so when the physician or clinical researcher, when they develop the clinical trial, they usually develop the cohort criteria first. So for example, who is eligible to participate in this clinical trial, and who is not eligible, who is not eligible, who need to be excluded from those clinical trials. So we call that including criteria and excluding criteria. Some of the criteria can be mapped using those structured data. For example, the age, sex, diagnosis code, those can be easily handled by the structured data in the EHR. A lot of the criteria cannot be handled easily by the structured EHR. For example, the family history, like exclude some patients who have like family history of cancer. Right? This kind of criteria is very hard to handle using structured EHR data. So that's why we have to use those clinical nodes and those unstructured free text EHR data to handle those clinical trials, and then find those eligible patients who can be recruited for the clinical trial. So that's why NLP can play an important role to recruit patients and expedite the clinical trials.
Definitely, yes. I think, we see NLP playing a big role in finding the right patients for clinical trials, also in designing protocols,
Yeah,
right, and finding if deciding which sites to set up in. Absolutely,
yeah,
yes,
yeah.
because yes,
And
there's a lot of
many,
relevant. Okay, go ahead.
yeah, many cohort exploratory tools have been developed. For example, a lot of CTSI centers, like the centers founded by the CCAT, NIH CCAT, a lot of centers, they have those cohort discovery tools, like I2B2, those kind of tools. And also Epic have similar tools, like Slicer Dicer is a part of it is one of the to explore the cohort, find the patients. However, most of tools they couldn't handle unstructured data. They couldn't
Yep.
handle the text data because it is very complex. So I can give you an example, like the indication is very hard to detect, right? And also the temporal information. So for example, the in the clinical notes, it may say this patient take this medicine 3 weeks ago, or some temporal information there. So if in the cohort criteria is if such temporal information is mentioned, we have to consider, okay, whether to include this patient or exclude those patients. So previously, all those uh, all those things are being done manually. So a lot
Yep.
of times the study team have a nurse or study coordinator. It's their full-time job. They have to manually go through the clinical text and screen those patients. And right now we have those tools, NLP tools that have the capability to help them to help those people to find out who are the eligible patients and provide some evidence why this patient is eligible and what part of the notes is relevant to the criteria. Right. So this is really fasten the work and make this patient identification more efficient for clinical trials recruitment.
Yeah, great. Yep.
Mhm.
So on to the next topic. You've also done research on social determinants of health with the goal of improving health equity. Can you please share how NLP applies to this challenge?
Sure. Yeah. So I can first I can explain the term first. So social determinants of health, or SDOH. Sometimes people also call that social and behavioral determinants of health (SBOH). So they are the conditions in the environment where people are born, live, learn, study, work, play, worship. So it actually affects a wide range of health, our body functions, and quality of life. So SDOH has a major impact on people's health, well-being, and quality of life. And SDOH also have major impact on the healthcare outcomes. For example, the housing environment may impact your mental health, right? And your social economic status may also impact the clinical outcomes from the treatment. And also SUH also have major effect to the wide health disparities and inequities. Like if you are living in a rural area and you don't have access to transportation, you may reluctant to go to hospital regularly or even for the regular visit, right? Because maybe you have to have a car, and if you need some wheelchairs or something, you have to have some other people to help you get into the transportation. So those kind of SUH really impact people access to the healthcare facilities, and of course impact the healthcare outcomes. And why NLP is important to SUH? Because when we study SUH, traditionally researchers, social science researchers, or clinical researchers, they send out survey or questionnaire to people to collect those social determinants. But it's very time consuming and very expensive to send out the letters. And nowadays, people are using electronic health record to collect those data. A lot of the data are actually documented in the free text format. So, for example, the clinical notes, when a physician see a patient with mental disorders, they will ask a list of questions related to like housing, environment, those type of things. And when a physician sees a patient with a disability, he will also ask your transportation status, your socioeconomic status, those kind of SDOH related factors. However, those information are usually documented as free text, and we have to use NLP to extract those SDOH concepts in order to make it that useful for the clinical research, or make it useful for the to make the clinical outcome, treatment outcome better. So, however, there are many challenges in extracting those factors. So we just had a study. We try to study the sleep-related information for patients with Alzheimer's disease. So we use the clinical notes from the UPMC, and we develop NLP tools to extract those sleep-related information. However, when we develop the algorithm and when we develop the data set, we find that those type of information is really not regularly, not frequently documented in the clinical notes. So that happens to other SDOH as well, because it's not there's no guideline for physician to document those social determinants of health, right? So that's why a lot of missing information for the patient, and also there's a lack of ontology, standardized ontology and a terminology for SDOH, because SDOH is so broad, right? And if we want to extract some concept, we have to know what we want to extract. But defining what we want to extract really need a lot of efforts.
Yes. Yep. Yeah. In the last healthcare NLP summit, there was one talk by City Block, right, about extracting housing insecurity information from clinical notes, and also, I mean, that they noticed those two problems. One is that really it's only going to be there if the doctor thought it was relevant to that specific case, right? So you really don't get a complete picture. And the other problem is that it's not a binary question, right? It's not like, do you have a house or do you not have a house? People have tons of living conditions, right? It's the same thing about employment, relationship status, right? Food safety, transportation, right? There's a very broad range of things that people have to live with. Yep. So it's an interesting problem. Absolutely.
Yeah, exactly. And I believe all those factors need to be considered when people build like machine learning model or AI model to predict the clinical treatment outcomes, because all those factors are really, for example, insurance status, right? Those are big factors for the treatment outcome. So we have to consider all those social SDOH factors when we build the models. And this kind of model is really like a precision AI model for patient health.
Yep. Yes. So, from your experience, what is the hardest thing when putting new NLP research into practice in a real healthcare setting?
Okay. Yeah, that's a very good question. So I think the first hard thing is like the regulation, because the healthcare industry or healthcare sector is highly regulated, and if we want to push the, I think so there are many different areas NLP can work in the healthcare industry. Like, so NLP can work for improving the clinical workflow, quality improvement, right? So that maybe can work better, because you try to improve the clinical workflow. You try to improve the quality that the hospital can provide. So that may not be a very hard problem to put NLP in healthcare. And the second thing is clinical research or translational research. Like we develop a lot of NLP algorithms to facilitate the clinical trial recruitment, right? So this is a tool that researchers can use to facilitate their research. So NLP, we also develop NLP tools for discovery to understand the relationship between disease and some risk factors. So that's also not difficult to implement or putting NLP into practice for those research. However, when we talk about putting NLP into the clinical practice, into treating patients, so there are a lot of challenges like the regulation, because healthcare domain is highly regulated, and you have to show that your NLP tool, when your NLP tool is not biased, or you not have no ethical issues when you put those tools into practice. You have to went through those like clinical trials before putting those tools into practice. I think those regulation is the hardest. And also when you put those put some research into practice, and when you really embed those tools in the EHR system, because the EHR system is different. There are so many vendors on the market for the EHR system, and it's not easy to embed those NLP tools in those vendor system. So you need a lot of stakeholders support. For example, you need support from the healthcare organization's leadership. You need support from the health organization IT team, and you also need support from the EHR vendors IT team, right? So those kind of stakeholders support is also not easy. I think there's some challenges I think I can think of. Yeah.
Yeah, I think I would agree. Those are the big ones. Yes. So
yeah.
looking forward, what's the biggest trend you see for NLP in healthcare, say in the next 5 years?
Yeah, I think looking forward, I think we will continue to see a lot of models will be developed for the specific for clinical and medical NLP. And right now, the model is becoming bigger and bigger. But in the next 10 years or 5 years, I think there will be a lot of smaller models. The model will become smaller and smaller, but have very comparable performance to our big model. Right? So I think there will be a trend, and a lot of researchers have been working on this. And the other trend is, I think we will see a lot of NLP tools will be started, will enter the market, and a lot of healthcare organizations will use those NLP tools, or it may be not NLP tool. It may be just a component of AI tool, like for example, when we build predictive modeling, we may need NLP as a component in our AI model for the prediction. So a lot of NLP will become a component of the big AI model, and also the multi-model machine learning. NLP will become an essential component of those multi-modality models for the healthcare domain. And also I think we will also see a lot of new regulations and new guidelines to test and evaluate the bias and ethics of those models before putting those NLP models into like practice. And of course, our team is also working on because in clinical NLP, the data is always the issue. We don't have a large amount of data. Because every problem maybe is specific, and you may not find the well annotated data in public. That's why we have to develop our own. We have to annotate our own corpus in order to develop the algorithm. And even though there's a public algorithm, I know Spark NLP have a lot of fantastic algorithms already there, phenotyping algorithms there, but we have to test the generalizability of the algorithm, because each institution is different, and the vendors are also different. So the text NLP clinical notes are also different. We have to test the generalizability of those public NLP systems.
Mm-hmm.
That's why we have to develop our own annotated corpus. So, but that's a very time-consuming and challenging task. So our team is also working on some methodology like few-shot learning, zero-shot learning, so that we don't need large annotated corpus. We only need a small number of annotated data set that could be used to validate the generalizability of the clinical NLP systems, and also develop our own NLP system. I think those systems requiring smaller number of data sets will become a trend for the clinical NLP area. And also the federated learning approach is also another trend for clinical NLP, because no healthcare organization want to share their data. So the NLP as a service or the federated learning for NLP will become a trend, because the healthcare organizations, they don't need to share the data with other institutions, right? The data stay on their own database, but the model will learn the nuance from those data separately, right? So this will be another trend.
Yeah, and I agree with you. I think in general, it's not that healthcare NLP model generalized poorly, is that there is really real variety in how people write and how people speak, right? And I completely agree with you that one of the challenges, absolutely, we need to evolve zero-shot learning, few-shot learning, and that's one thing. And the other thing is really have no-code tools, right? So that, when you go into a new environment, really, ideally within half an hour, right? You start the model, you train, you show it a few more examples, you localized it, right, and you're ready to go, absolutely. And you have metrics you can trust for that location. Absolutely.
Yeah. That's exactly. I can think of another trend. Maybe there will be a lot of more tools that can be used by a layperson, because right now a lot of tools, you need some NLP expertise in order to use a tool, but not every healthcare organization have that expertise. Maybe big organizations like UPMC, like a Mayo Clinic, they do have NLP expertise, but some smaller hospitals, they may not have those workforce ready. So tools that can be used by a layperson, by entry-level person, will become more and more tools like that.
Yep. I absolutely agree. I think that's definitely a barrier, and I think we are. I think also we are going to solve it in the next few years. So I think it's going to be interesting. Yeah. So listen, Yanshan, thank you so much for joining us today. I greatly enjoyed our chat, and I learned a lot. And I definitely look forward to see all the research and projects that that you and your team will create in the next few years. So thank you.
Thank you, David. Yeah, thanks for having me.
Thanks, everyone.